Okay, we've heard 5 excellent presentations there, and it certainly gave me some food for thought, and I hope the same for colleagues in the audience. We've got a few minutes for questions. We are still overrunning, but we are overrunning no more than we were when we started. So we will have 5 or 10 minutes for questions. Anybody in the audience like to start? This lady there. Have we got a microphone, anybody? No microphone? Okay, just shout really loud, please.
Okay. 2 questions, I guess, if I interpret correctly the question. Sustainability. To me, it's a very important problem, no doubt about that. To me, the aim here is to be able, at the end of the project, to achieve mainly 2 things. One is collaboration with existing databases that will be there in the future, and even databases that are not going to be open, be able to provide an open knowledge base, this knowledge graph that I talked about, be able to provide it openly, publicly, for people to work on and build on. In other words, how can we get useful knowledge out of things that are not open and make this knowledge open and base further research on this? I hope that this, for the 2 cases that we're dealing with, this will be achieved by the end of the project, and my ambition is that this will be used further after the project. What was the second question? We have not contacted BBMRI, but we are in contact with and collaboration with various other Central European facilities. Actually, the hosts of EGA are part of the project, and I mentioned already some of the UK initiatives like the UK CRISP, UK Biobank, and also data platform, Dementia Platform UK are people who we are talking to, but obviously we're very much interested in talking to other people, and we are establishing collaborations, and we discuss with people about this possibility.
Okay, panel members, just give me a feel for what additional governance, ethical, legal issues, some of the things that you've been raising this afternoon might bring. Either give some reassurance to the audience or indeed some caution to the audience if you think we're going to have some significant issues to grapple with going forward. Andrew, do you want to kick us off on that one?
I think undoubtedly there's lots of issues here. So in my presentation, I was pointing to what was possible and what might be this huge benefits of being able to have access and use to data on the scale that I was talking about. But the journey to get there is going to be full of barriers and issues and challenges. I think one of the things that comes out from looking at data is that at its most valuable for the individual and for the healthcare system is having a more holistic, person-centered model of data. I think one of the challenges we have at the moment is that we look at data through narrow, fragmented lenses. We look at it through condition, or we look at it through actor, or we look at it through some thin slice of health and well-being. So the data of an individual is scattered across many different parts of the healthcare landscape. Not having a centralized picture of how it all comes together to be of most benefit to the individual and to the healthcare system is a challenge. Now, some of this data is less contentious. One would say health and well-being data. People seem to be sharing a lot of that already on Facebook and other things. But some of the more critical health data is much more prone to health, to sort of issues of privacy, etc. So I think, as talked about in this conference, the sense in which the ownership of data needs to move more towards the individual granting access rather than held by the system has got to be a way forward. But as to what kinds of data will people be prepared to share and when will they be comfortable to do that, there's a huge conversation that needs to open up between people, healthcare systems, politicians, legal people, because the amount and richness of data coming through that we need to pass through this discussion is huge, and I think we're only just starting that conversation.
Sure. Any other panel members want to have a go at that? Andres?
Yeah, so obviously I agree with what Andy said. I think also what we need to work towards is a legal framework that describes the rules for accessing all the data. So there's a lot of public data, and we need to figure out ways that private companies can access that. If I go to a hospital, public hospital, should it be able to say no to me if I'm trying to do good? That's one thing. So that's at the level of policy, government, even European level policy. I would also say that a lot of times, again, some of the information that Andy is referring to, personalized information, there is the concern by people that even if it's non-controversial, it could be used potentially, for example, by insurance companies against them. And so I think, again, it's a matter of coming up with the right policies that, in a sense, force, in this case, insurance companies, or make sure that insurance companies do not use this kind of information, if it's divulged, in the wrong kind of way to sell me a more expensive plan than they would have otherwise. So there's at least two more, I think, that people should be aware of.
I'll just throw one extra thing in there, which is if your business model is based on using data, there's a tension there between what you might want to use the data for as a provider and the person's desire for privacy. So there's an interesting set of tensions in there that will need to be managed by regulation and legal framework.
I mean, we hear a lot, don't we, about patient and citizen access and the citizen granting access to the clinician and all that sort of stuff. Does that remove the issue of consent altogether for us?
I think no, but again, there's a question of, now I'd say that there's a question of education, that a lot of time people they need to be fully aware of the implication of divulging, so they might, give consent and then come back and say, I thought, this was going to be used for that, and then it's used for X, and then it's used for Y, and I don't consent in that case. So I think there's a lot of opportunity there, or a need, I would say, not an opportunity, to make sure that this kind of education is also sort of made available. I don't know what's the right answers, but I think it's an issue to, of the agenda.
I would like to add to these discussions a view which is very different from the talk that I gave. I'm involved in some patient organizations from the patient side, and there are initiatives now in Europe to try to collect the feedback from patients about whether they want the data to be used and how it can be used for promoting research or for other purposes. And the response of patients is, in general, very, very positive. Given that we can satisfy some some safeguards. And I think technically we can, to a certain extent, to the extent that it is possible. I mean, we're talking about distributed processing, blah, blah, and so on. But still, even when the consent is not a problem, we still see very little sharing of data, which is crucial to promoting research and finding better cures. And I think we need to think a bit more about the incentives of people, of medical researchers who are collecting these data, how can we explain, how can we make them understand that sharing the data is better than not sharing it?
Sure.
I'll just add to that. One of the things more widely outside of health in terms of people's relationship to signing up to give consent for their data. And most of you will be familiar with apps and all sorts of things that ask you to give consent. Less than 1% of people ever read it. So over 99% of people are granting access to data that they don't understand. Healthcare, we're sort of held to a higher account than that. But I think one of the things that we can learn from the private sector and more generally in the digital world is that when there's reciprocity, when I get value from sharing my data and I can see that value and it's tangible for me, which may be a different kind of value than the one that the person who's receiving it gets, that reciprocity needs to be there. And I think people are much more open and willing to share if they understand not only what it's being used for, but that there is value to them as well from sharing. And we need to be sort of less paternalistic and more understanding of how we do that.
Sure. And
can I make a question to Mr. Wilkins? So, well, of course, I suppose it seems that it's obvious that one of the risks for implementing this nice vision that you showed us earlier is certainly, that data regulations and privacy issues, etc. So, I was thinking of another issue as well, which Mr. Persidis alluded to, is the AI winter, and the risk that exists that probably, for example, artificial intelligence does not necessarily deliver to at least at the timeline that we would like it to deliver. How have you included or that risk in the vision that you have provided to NHS or in this planning that you are trying to do and you are trying to work on? I mean, the thing that finally artificial intelligence, every now and then, I mean, there was a spring at some point, there was a lot of belief that it comes and it will solve all the problems of the world. Then there was the winter, and then again, it seems that we have like a spring again, but there is certainly a risk that, we'll have a cycle of, artificial intelligence really disappoints us after all at some point. Okay. How do you think that affects this as a risk in general, the plans that you have presented us?
Okay, well, what I presented and the work that we've been doing behind the scenes is really sort of rolling forward the trends as far as we can see them. But what's phenomenal about coming out of this winter is the increase in processing power, the better access to data, new algorithms coming through. So what we're seeing is a almost explosive growth in terms of the sophistication of machine learning, deep learning, and AI, if you collect them as a family. So 3 years ago, a machine couldn't recognize or really what a dog or a cat, an image of that was. 3 years later, it can recognize every single different type of cat or dog better than a human ever could. So in the course of 3 years, the sophistication of some of these algorithms has leapt on leaps and bounds. So I think in thinking about the vision I was talking about, we're certainly in a position where there's going to be lots more data coming out from people's bodies, as I was saying, about the behaviors, about the environments and smart homes and smart cities. No human is going to be able to have the time and effort to even look at that data. So in some ways, we're going to have to deploy things like machine learning to look at all of that data and parse it and make sense of it. And in the earlier phases of the vision, before we actually arrive there, of course, there's going to be that pattern recognition that then gets shared with clinicians and public health specialists who will see patterns and then try to understand what this means. And as we get better at understanding the patterns and we start to be more confident about the patterns, then we can start to devolve maybe some of that experience or some of the decision-making capabilities to the algorithms as they become better known and better understood. So it's going to be an emergent story that comes through, but the direction of travel, the sophistication, the sort of upward curve of AI and machine learning is really phenomenal at the moment. And it's not beyond the wit of man to sort of project even a kind of modest slope forward 10 or 15 years and say that we're going to be able to deal with multiple complexities through the use of algorithms that are going to reveal things that today are just not seen or not known or not capable of being seen. One thing I think one of your points was the very nature of health itself is not one that's fixed. We're not like robots. We can sort of deconstruct us to our atomic bits and we can make predictions. It's going to be about probabilities, as you said. So I think it's recognizing right the way down from as genes communicate themselves through protein markers that then communicate themselves into as we start to see patterns evolve and we can see them in the blood and we can look at how these things then evolve over time into disease-perturbed networks that became chronic disease. As we start building up all this data and seeing these patterns, we start to understand how disease progresses, how it originates, how it evolves. There will be patterns there that allow us, through this kind of technology, to go, aha, there's a high-risk events going on here that indicate that people are on the trajectory towards a particular disease. We can make an intervention at this point. And as I was saying earlier, the ability to do that, to be able to spot and see pre-symptomatic the origination of disease and has got to be the greatest thing for mankind. So it's a fantastic new world opening up. It will take time. It will take time, but that is the direction that is going to, and AI was going to play a big role in that.
Fully share the vision. I'm just saying this because when one looks back in the history of artificial intelligence, there have been moments in history when people that were more or less in the same point, really believing that, with this revolution is very close. But it wasn't that close after all. But okay, certainly there are steps we are moving forward. At some point, it seems that it's coming. But,
Okay.
sooner or later.
Yes.
Okay, I'm sure everyone would agree that's been a very stimulating and thought-provoking session. Please thank all our panellists in the normal way.